Welcome back to Out of the Rough. I'm Fred Arnold. I'm joined by Scott Zimmerman. Scott Zimmerman is a good friend. Actually, I enjoy working out with you at one of the gyms we work out locally. Also a Provisor, which is a network group we belong to. But you're also a partner in Corporate Strategies Incorporated. Welcome to the show.
Hey, thanks for having me.
Now, I wanted you in for a while because I want to talk about something that's really important that you do, and it's almost like risk management, isn't it?
It is.
I want you to tell me about some of the services you provide.
Okay, well, just a little bit about me. I've been in business for 25 years. I'm a partner of Corporate Strategies, and we specialize in employee benefits, so health insurance, vision, dental, all the different plans that
Health insurance, that's fun this year, right?
Oh, it's so much fun. But it's been good. It's actually been good. And then we also, that's half of our business, and the other half is life insurance, long-term care insurance, disability insurance.
Yeah, so the whole gamut of, and I call it risk management because you're managing against a risk of something happening. I want to talk specifically about something that's a hot topic right now, and that is long-term care insurance. I mean, why do you need it? What age do you need to get it? What's it all about? So
okay, that's a good question. Long-term care insurance has been around for approximately 25 years, and the plans have changed through the years. But why would you need it is if you have any assets that you need to protect, or you don't want to go through your assets in the event of a long-term care. I mean, long-term care is if you need care in your home, you need to go to a nursing home, something of that nature. So if you don't have long-term care insurance, you will have to spend all your own money before the government will kick in and take care of it.
So in some of the long-term care facilities the government provides are not long-term care facilities you want to be in.
That's right. This will give you choices of if you need the care, where you want to go. And that's another thing, just to, 1 out of 2 people statistically will need some form of long-term care.
Yeah, if you're not sure about long-term care, go to a public facility and see what it's like, because it's not as good as we would like to be, and we'd like to see our life, the last years of our life lived in, or temporarily live in while we get healthy.
Right.
Let's talk about who needs it, and at what age. When do you start? When do you look into it?
The time to get it is a couple things. When you're healthy. Because if you're not healthy, you won't qualify to be able to get a plan. That's number one. Number two is a good age. Most people are buying them long-term care policies from 50 to 70. That's most people.
Now you have it, right?
I do. I'm 40. I've had it for a couple of years. I'm 47, so I bought it 2 years ago. I bought a plan that it's not around anymore. But long story short, you pay for it for 10 years and I own it. So I have it. So anyway,
and that's important.
Yeah, I think it's really important, especially if the key is if you have assets and you want to protect them and you want to leave them to your kids, and not if you need care, you don't have to spend all your own money to take care of it. This insurance will take care of all or most of those bills. It all matters how you set it up. And the way you set up these policies is you design it exactly how you want it. A daily benefit or a monthly benefit, how long you would want the care for, and statistically, care for people that need home health care, someone come into their home and take care of them, statistically they need it for about 4.5 years. And statistically in a nursing home, it's 2.5 years. So you can design a plan to fit exactly what you're looking for.
Fit exactly what you want, and it doesn't put the burden on the children to foot the bill. It doesn't put the burden on all the assets you saved your entire life for. So it's a pretty big ounce of prevention, but to get a lifetime benefit.
I'm sure we all know somebody that's had to go into one of these nursing homes, and it's very expensive.
Well, let's talk about specific examples. Okay. Give me some example where someone can get sick, and it costs, what does a nurse cost? $3-4 grand a month to come into your house every day?
Minimum, exactly. And now, do you need them for 8 hours or do you need them full time? So there's a whole gamut of what it's going to actually cost. The average care in a nursing home facility for a nice, decent nursing home is about $200 to $250 a day right now, and it's escalating.
That's hefty when you do the math on that. $6,000, $7,000 a month.
Yes.
Right.
Yeah, could be more.
Yeah.
But yes.
And your rent on your home is only $2,000 or $3,000, right? Or nothing at that point.
Exactly.
So you're burning into every asset you have in many cases.
If you save $250,000, $6,000 a month into $250,000, I mean, it's not going to last that long, right? If you need it. So.
Tell me about the different plans that are out there.
There's a few different plans. There's the traditional long-term care plan. So you're buying a daily benefit, like I said, and it'll pay for X amount of years. And then there's some new hybrid plans that have come out lately. One of them, they're based around a life insurance policy. So you buy a life insurance policy, and let's say it's $500,000. Through this life insurance policy, in the event you need the care for your home or nursing care, you could pull out 2% of the death benefit on a monthly basis to pay for the care. So it kind of eats into your life insurance. But the nice thing about it is, it's if you don't need the long-term care insurance, because a lot of people will say, I'm never going to need it. I don't get sick. My dad lived to be 100. If you do need it, because you never know, at least it's there. But if you don't need it, you got life insurance for your family.
To help protect your estate.
Exactly.
Yeah.
Or leave it to your loved ones.
Yeah.
Exactly.
Yeah, very, very important. How those want to reach out to you, get you?
They can reach out to me by telephone anytime, 818-377-7260, or they can email me at scott@corpstrat.com.
Great. Thanks for coming in.
Thanks a lot.
Glad I got you in.
Thanks.
Keep working hard at the gym so that
You
you can continue to live a healthy lifetime.
That's right. Thank you.
Well, I hope you enjoyed this edition of Out of the Rough. If you'd like to watch this online, go to scvtv.com or fredarnold.com. If you have questions or want to suggest a great guest, like I have here for Scott, email me, fred@fredarnold.com. I hope you enjoyed this information, and this information helps get you out of the rough and into success. Until we speak again, make it a great day. Bye-bye.